This video will show you first-time setup and customization within SA anesthesia.
For the majority of these steps, you'll only need to do them once. Just please make sure you log out correctly. Don't let it time out or else your settings won't save. So firstly, we are in select case. We're going to create a blank record for the purposes of setup. Blank record's the process we'll use in the future for starting cases that are not yet scheduled. When you select this, you will get a create blank record screen. Here, the location is mandatory, so click on the binoculars, select recent, and please tick the always prompt with recent. This will ensure that when you're trying to locate patients in the future, it will make it nice and quick and easy for you. Now you're going to go in and select your location. So open up East Surrey and select the theatre you want to locate. And we're going to locate Theatre 8 today. Select OK. Now, good practice is putting your initials at the front of the record description. So just pop your initials in there in front of the blank record so we can locate it later. Select OK. And now you'll see the select device screen. You'll get used to seeing this screen every time you launch SA. For the purpose of this video, we'll select cancel because we're just setting up. So now this is your anaesthetic chart and we can start customizing. So here you can see the taskbar. In order to change this, you right click and you customize. This is the screen that lets you add and take different tasks out of that bar. So firstly, we're going to add in values and monitors. You click on them and you move them over. Now to remove things, we're going to click again. So today we're going to remove change preview first. And we're going to move that over. And we're also going to take out continuing orders and inventory. Once everything is where you want it to be, you can select OK. Now you'll be able to see your tasks across the top correctly. I'm going to show you how to add a slider button to your anaesthetic chart. You'll need this later. This has to be done every time you open SA Anesthesia. Navigate to View, Sections, and select Detail. This then puts the slider onto your anaesthetic chart. The slider allows you to see observations in more detail. For instance, you can see some observations taken outside of the 5-minute intervals, for example, heart rate and blood pressure. You need to exit properly. So navigate to Task and select Exit. Not exiting properly will mean that your setup won't save and you'll have to do it again. If you have any questions about the content of this video, please contact the digital training team at SASH.